Good morning, everyone. It is so great to be with you all today. You all showed up strong, just like the state's budget. And that's my corny joke for today. I want to do a bit of context setting before we start the conversation with our panel. This year really is like none other. If you have been following the budget conversations and the news, our state is seeing an unprecedented surplus. California state government has and will receive over $27 billion from the federal government, $6 billion of which is for childcare, which includes CCDBG funding, CARES Act, and ARP funding. The state has a projected surplus of $38 billion. This is discretionary funding that can be used for anything. The past year or so has also been a time of great loss. During the pandemic, California's EC system has lost over 8,500 childcare centers and in-home family childcare sites. 14% of which were in-home family childcare sites and 33% of center-based care. Those are big numbers, good and bad. Given the flush of new funding available, our state and economy reopening, it is an opportunity for us to reimagine the ECE system and what it can provide to fully meet the needs of our youngest learner and their families. And this is the theme you guys are going to hear over and over again today. We can learn from our K-12 partners and the administration's interest in school-based comprehensive services focused on the whole child, like the community schools, which has a proposed infusion of $3 billion in the governor's May revise. So how can we replicate those efforts? How do we take the funding opportunities and couple them with reimagining the 0 to 5 system, an essential system that we have been fighting for many, many years? This is the time when we really can ask for it all. We can do so, and we can do so without worrying about whether it is at the expense of other kids within the 0 to 5 continuum. The 0 to 5 system can be made whole, and the young children prioritized in this year's budget. We just have to make sure it's done right. This discussion will explore how we can use this moment to reimagine and rebuild, as Vicky said, through an equity lens that offers holistic supports and advances racial equity, economic justice for our youngest children, who are children, predominantly children of color and dual language learners, and they're served by ECE providers, majority of whom are women of color. That will be our conversation for the next 50 minutes. Some housekeeping for our audience. You can submit your questions to our panelists in the chat, and we'll either try to incorporate your questions into our discussion, or we'll try to address them at the end of our if the time allows. With that, I'm delighted to introduce our panelist, Hana, Senior Policy Analyst at the Education Trust West. Hana leads at Trust West's early learning portfolio and contributes to research and analysis of policies and practices in support of educator diversity and educational equity. Our second panelist, Keisha and Nzewi. As Director of Public Policy for California Resource and Referral Network, Keisha brings her years of experience as a community organizer and advocates to advance policies and practices that support providers, children, and families. And Max Arias, Executive Director at the SEIU Local 99, who has 2 decades of organizing experience, believes that through the struggle of workers, we can dream of a society where children have access to good education, safe neighborhoods, and food security. With that, Max, I'm going to ask you to start us off by giving us an overview of the work of the SEIU and the California Child Providers United through the pandemic. And the same question to Keisha and then Hana. Take it away, Max.
Thank you. Good morning, everyone. It's a pleasure to be here and a privilege as well to be here with the esteemed panelists and to be here with you this morning. Want to start off how our providers, starting off with the pandemic, right? We're talking about that, but I just want to illustrate when the pandemic hit, providers were already on the verge of a union election Actually, it was postponed because of the pandemic. And the reason that's important to understand is because there's a reason they were driving to the union election, and it has to do with, with actually not being able to make ends meet, given that the reimbursement rates are so low, given that they have a lack of support they don't have a clear infrastructure support around them, and it really became apparent when the pandemic hit. And I don't have to tell you, they have no access to quality healthcare. There are, many thousands of providers that are working that are over 70 years old, but they have no way to retire, and they will continue to work. And they've been doing the work for 30 years, 35 years. And all those conditions are unacceptable. And again, it comes down to it's women of color and it's service work that has not been valued. Actually, it's been expected that women will provide that service for free or for nothing, for very little. So it's important to understand that the state was pretty bad. If the workforce was not good, that's why they were on the verge of unionizing. Then the pandemic hit, and there was an immediate detrimental effect. For example, they couldn't even have access to cleaning supplies, and they did not have access to safety equipment. And the reason they needed this is they are the only, to my knowledge, the only early learning that was happening in a classroom setting was the family childcare provider setting. So they never closed down. They continue to provide childcare and early education. And without them, it would have been a total collapse, I think, because essential workers would not have been able to work. So there was a detrimental effect in that, and then the increase in costs. Their costs ballooned to no end. Family childcare provider costs. Many of the driving reasons, one of them was distance learning. Now the school-age children that they cared for, either in the summer and after school type setting or before school type setting, stayed there all day now. They were there because they would not go to school. And providers took it upon themselves to figure out how to support them in distance learning. So they would sometimes have 10 children with 10 different teachers in 10 different screens. That led to them having to hire assistants, provide more meals, and just figure out how to get more cleaning equipment. You can imagine, right? And put these plexiglass screens, etc. So the increase in cost was pretty crazy during distance, but they maintain a lot of these children would not have been able to receive distance learning at home without providers and their assistants supporting them. So that's something that's really not quantified, but it's important to understand. And at the same time, as all this was happening, there was no increase in resources because the reimbursement rates that have to do with school-age children for those type of programs are way lower than it is for actual care. And the expenses were adding up. They were having to provide more services, but they did it and they were doing it. But at the same time, they spent a lot of the resources, and you heard, we were sounding the alarm as a union, and providers were closing at an alarming rate. You heard right now over 6,000 slots. I think 6,000 centers and childcare providers closed. Thousands and thousands more actually than during the recession in 2008 have closed. And then all this was happening. We had a union election that gave us the ability to immediately demand to go to the table with the state over a lot of these conditions and changes in working conditions, and just really mobilized and in coalition with many, probably you here, push for these COVID-19 relief agreements to try and bring about some stability to the industry. So we mobilized, and through the table process, we're able to push the state to spend the federal money in ways of providing stipends and support that are still, by the way, not all providers have received. I just want to say that right now here, the support from the state. And so and at the same time as we got these COVID relief agreements, we started a negotiation for a first contract, understanding that there are many right now, I don't want to call them necessarily, there's not opportunities, there's things have been exposed. Now, what I mean by things have been exposed is the pandemic really exposed how the conditions are, and actually it's become now a public demand to ensure that all working parents have childcare. So through with that lens in mind, and also ensuring that to provide excellent childcare and early education, the people doing the work also have to have excellent work. excellent jobs, and these are not jobs, they're small businesses, so we know that, but they have to have an appropriate reimbursement rate. Given the reimbursement rate is governed by the state, and we call them small businesses, but then we don't give them freedom in actually ensuring to make ends meet. So if we're choking, that they will continue, the providers that will continue to create crisis, less access to childcare, and then so it's important through with that lens, through our contract demands, to what we've been doing is making proposals as solutions to some of these issues that really hurt providers, right? For example, low rates, reimbursement rates, we know they're really low, and we're all fighting. I think everybody hears that, so we need to get those up. They're at 2016 levels. They need to come up closer and go back to kind of where they were, but that's just to create a floor. The COVID-19 agreements were meant to start the stabilization, but we still need to do more to stabilize the industry right now. We also have to, through our proposal, we need to figure out how we support those providers that have lower capacity now. And we have to also understand that providers have been caring for a lot of school-aged children, and as well as children that may have been going to center settings and others. And all of that, the potential will be lost to them if the children go back. They're going to go back to school, and the children going back to centers. So I think it's important for all of us to act as a team to make sure that there's a mitigation, that this does not happen like that, and that there's a choice for parents. Another thing that we are trying to address through our bargaining process, ensuring that there's a level of benefits and support, so that especially now, post-COVID and through COVID still, to quality healthcare for family childcare providers and their assistants as well. And also need to continue to sound the alarm that, not the alarm, but the master plan that calls, but it seems to be leaning very heavy on just kind of transitional kindergarten models or center models. Does not take into account yet, we have to push it to take into account that around 70% of parents will use the family childcare providers as their primary early education, given the flexibility as well. And if not, they also use them for care, childcare when needed too. So it's important for us to push back on a model that is only when we talk universal early education, there has to be option for parents, and we have to support what the majority of parents are doing, and we have to make sure that family childcare providers, after this pandemic, do not end up where they were before, but progress. So that is our goal, and that's what we're moving up to. And thank you for the time in this space.
Thank you, Max. Keisha?
Good morning, everyone. I'm Keisha Nzewi with the California Child Care Resource and Referral Network. So for many of us, our last work gathering was more than a year ago at the Water Cooler Conference in Sacramento. And in fact, don't judge me, but I finally dug into my commuter backpack in December, looking for something that I didn't find. But what I did find was my water cooler program. And I reflected that at that gathering, COVID was in our conscience already. We were avoiding handshakes and hugs, but we were still extremely ignorant to the year to come. Weeks before the full shutdown, as Max described, childcare providers were struggling to find cleaning supplies and food they needed to continue caring for our children. And almost overnight, many childcare centers found themselves forced to close as new cohort guidance prevented them from caring for enough children to be able to pay staff, rent, or mortgages. And home-based providers were at Costco and Sam's Club with the rest of us trying to get paper towels, toilet paper, or cleaning spray, yet they all persisted. And who else persisted? California's best kept secret, our more than 40-year-old R&R infrastructure. Before most of us knew what hit us, R&Rs pivoted and became Amazon warehouses, providing much needed cleaning supplies, food, diapers to childcare providers. They provided online playgroups for families, online professional development and training for providers. They spread information about PPP loans, our state's small business grants, continued to recruit and train new providers. There really were people wanting to get into this business in the middle of a pandemic. It connected providers to vaccination appointments, as frustrating as it was for everyone. And until this week, the importance of filing your taxes so families can receive the refundable child tax credit. Today, though, California has lost a third of its childcare centers and 14% of childcare homes. And in some counties, those numbers are upwards of 50%. But Governor Newsom promises that California's economy will fully reopen on June 15th. So I think we're all really ripe for a rude awakening. Parents who've kept their children home this year may find the care they knew and loved is gone, and a new one will be harder to find than ever before. According to the UC Berkeley Center for the Study of Childcare Employment, the childcare workforce shrunk 20% over the course of the pandemic. And while R&Rs pivoted, just like providers, it wasn't easy. The culture and values of childcare resource and referral dictate a high-touch experience for all who enter their doors. So moving online was a huge paradigm shift for R&Rs that was done for many of them with much reluctance, much resistance, but they had to. And what we've realized is that that shift is one that will surely benefit parents and providers in the future, especially in California's most rural areas. The opportunities are endless to be able to truly meet people where they are at without requiring them to travel over 100 miles or sit in traffic for hours. R&Rs are responsible, we're responsible for digging us out of the ginormous hole the recession caused in the loss of family childcare homes. When they received increased funding over 2 years to help recruit new providers, R&Rs increased the number of available spaces by 30%. And really, we got the money for 2 years, but we really didn't get the money until the second year. So that was in 1 year that they increased the spaces by 30%. We find ourselves in another hole, and R&Rs are the essential in helping to dig us out. The other secret, though, is that R&Rs have been doing all of this work with no increase in pay from the state for decades. So what they were paid 30 years ago is what they are paid today. No, adjusting for inflation. If they got $10 then, they get the same $10 now. So like support for childcare providers and families, this part of our childcare system has been starved, allowing so many R&R staff who spend their days helping families find the care they need and supporting providers to languish on the same childcare waiting lists as those parents that help navigate the system. And another important thing about R&Rs is that they truly reflect their communities, culturally, ethnically, linguistically. And so the same workers at R&Rs that are helping families and helping providers, they look like the providers they help, mostly Black and brown women and other women of color. So while we strive to get back to normal, I see that the parking lots are all full and restaurants are packed. We can't, normal's not good enough though for us, for childcare. We need to be bolder than we've ever been allowed to be before. And I, for one, can't wait to get to work with everyone. Thank you.
Thank you, Keisha. Hana.
Thank you, Khydeeja. I want to say it's a huge honor for me to share space and community today with so many of you who are advocates, caregivers, educators, parents, and leaders. I'm bringing a lot of humility with me. I want to recognize that I'm only able to be here because I have childcare. My 5-year-old and 7-month-old go to Sequoia Children's Center in Redwood City, which serves over 60 private pay and subsidized families. And had they not reopened back in May of 2020, I would not be here today. I would most likely not even be working today. So I'm offering my gratitude to Sequoia. And I know that unlike Sequoia, Khydeeja mentioned that thousands of programs have shut down. And you've also heard that from Keisha and Max. So it's like Keisha mentioned, we need to be really bold in how we imagine this equitable early care and education system. So I work with the Education Trust West. We're a nonprofit educational equity organization. And we're focused on closing opportunity gaps from early childhood through college. And we do this through research, data, policy analysis, and advocacy. And we focus on low income children and students of color. When the pandemic first started in early 2020, we wanted to understand the biggest challenges faced by students and families. And to do that, we surveyed 3 groups: parents of young children, parents of K-12 students, and also college students. For parents of young children birth through 5, we did 2 rounds of surveys. And we did this in partnership with Advancement Project California and a number of organizations currently on this call right now: the Children's Partnership, Early Edge California, Child 360, DALI-E, Silicon Valley Community Foundation. I'm going to share a little bit about highlights from our survey because it really helped us ground our advocacy around what families need most during this time. We learned that 7 in 10 parents are worried about the mental health of family members, including their children. This is especially true for Black and Asian American Pacific Islander families. And while 87% of families agree that receiving referrals to mental health supports could help them, only 13% have received or have access to those referrals. Further, Black and AAPI parents are more likely to say that the pandemic has significantly disrupted their home and family life. And statewide, 1 in 3 parents are worried about impacts of issues like substance abuse and domestic violence on their family. And we saw this increase from the beginning of the pandemic to February of this year. 1 in 3 parents have skipped their child's meal as a result of the pandemic. And this proportion is even greater for Latinx parents, Black parents, and low-income parents. And we know that the cost of childcare continues to be a barrier. And for many parents, costs have gone up while hours have been reduced. And at the state level, 53% of parents say they cannot afford to pay more than $100 a week for childcare. And this percentage jumps to 59% for Black parents and 66% for Latinx parents. On a more joyful note, Black families, more so than families from other racial and ethnic groups, were more likely to say that they're spending much more quality time with their child as a result of the pandemic. And we learned that almost half the parents surveyed say that they see value in placing their child in a program where a language other than English is taught, even if that language is not their home language. And we also asked parents things that they would want to prioritize in the state budget proposal and in the master plan. And we learned that over 94% of parents support free high quality preschool for all 4-year-olds, increasing wages and professional development support for early educators, something really critical that Matt and Keisha both mentioned, additional childcare subsidies for infants and toddlers from low-income families, and also collecting data to make sure that we're improving the quality of care and that we use the data to better support children, families, and providers. So we saw some of these reflected in the governor's May revision, but not all of them. So how do we take what we learned and about what families need to reimagine and rebuild an early care and education system that leads with equity? I'm going to quote Mayra Alvarez from the Children's Partnership. I heard her say this once. She said that when children thrive, families thrive. When families thrive, communities thrive. And for the past 2 years, at Trust West has had the privilege of joining the Whole Child Equity Partnership. This is a collaboration led by Advancement Project California and brings together a number of partners, many of whom are on this call today. And the partnership collectively, we recognize that institutionalized racism has caused underinvestments across a number of sectors, including education, healthcare, and other social systems. And we identified 3 key areas of need going forward to reimagine a system. So first is to create an equity index that will enable us to shine a light on families that have the lowest access to support programs. Second is to use that index to identify 24 areas in California and establish whole family wellness hubs. These are very similar to the community schools that Khydeeja mentioned in her remarks. And if designed well, they will support families that with the many needs that they were expressed in the parent survey. And the third is high quality and sustained anti-racism training and support to early educators, ideally led by professionals of color. And I know that later in the panel, Khydeeja will facilitate a conversation to dig deeper into all the investments and what we're looking out for, including universal transitional kindergarten, the early care and education data system, and the number of increase in childcare slots and whether that's enough. So with that, I'll turn it back to you, Khydeeja.
Thank you, Hana. Thank you all for setting the context for our questions and our conversation today. And I think, Hana, you have already alluded to this. So my first question really is about, so we, you all have had to deal with, we all have had to deal with the pandemic and had to make end meets. Now, where do we go from here? And Hana, you have alluded to this. So how do we stabilize our system, right? What do we do to move forward and make our system whole? So you've addressed this, Hana. So my question to Keisha and Max is, can you talk about the state of the ECE field from your lens? What you've alluded to, what we have lost, right? So what are the lessons learned from that loss and what we have learned from the pandemic? And how do we use this moment with an abundance of resources to, one, stabilize and bring relief to the ECU providers and families, and two, set the foundation to reimagine and rebuild the ECE field, leading with the lens of equity and focus on comprehensive services and systems for the whole child, the family, and childcare providers. So what can our state do in order for that to happen?
So I don't know that our system needs to be stabilized as much as it needs to be unbuilt or burned down. Because its foundation. Max said in his opening remarks that as a service industry, that's historically been underpaid. It's historically been underpaid because it's based on racist roots, and we continue to perpetuate that in all of our policies. And so I would encourage us to, although the federal government and the state would provide stabilization grants, so we use that word, and that money is very well needed, so I'm not against the grants, but I don't know that our system needs stabilization. It needs to be, in my opinion, completely, we need to start over and take away and squash the white supremacist values that squash parents, that squash children, and that especially squash the providers in our care. We completely disrespect the care especially that home-based providers provide, primarily because those home-based providers are not usually white and often speak languages other than English. And therefore, we assume that they have no knowledge in the care and upbringing of young children, though for centuries, they were responsible for the care and upbringing of white children, and it was okay. It was more than okay, it was expected and required. So I think we have a lot more work to do than what even our budget process and legislative processes allow us to do, but as a field, we can be bolder and stronger and demand more and not accept the status quo. Max said, reminded us that we're using the 2016 RMR, and the other one, whatever, the surveys and the rate surveys. And I'm like, why do we have that? We should just pay the cost of care. And so even us, I see our boxes here on my screen. It is very hard to think outside of the box that they've boxed us into. And so we just need to punch these walls down, and we don't have to work within the system as it exists.
Well, completely agreed. I think I don't have much to add, just to add a little to everything that Keisha said. I think that it really is a structural problem, and it's a societal structural problem. And if we are going to make change, we have to change the structure itself. And so to what she spoke, it's really about, there's no such thing as rebuilding something that was, we don't want to rebuild it, actually, how it was, because it never worked, and for kids, parents, and people doing the work. So I think that it's transformative and important to continue to do work, but immediately, I think I just want to share the lens that we have, through the union, and I think in this case it's something different, because I think we're allied. I think that there's a lot of coalition built around this. That's not just labor, but what labor can bring is starting to change some of these things that can that are immediately needed. One of them is access to family child, affordable access, right, is important. If we can start fixing that by way of creating more slots, as we know, only 70,000, my understanding, that may vary a lot. The policy folks here, those numbers will tell me, but we're not even close to 10%, and getting to 200,000 slots is 10%. We're not even there, and Governor Newsom didn't even get to the 10%. And that's nothing, right? That's 10% of the parents and children that need this. So when we talk about starting to eliminate structural problems, access becomes something that's important and imperative. but access that also values the work that is being done. And valuing the work is not saying, wow, you're essential, we love you, we're gonna create a poster for you or something like that, as we all know. You really, to value, you really have to value it, show it. There has to be a rate adjustment. They have to be given access to healthcare providers. For example, let's talk about when we talk about racist roots. We know that we understand that there's a generational, that wealth is generational, and that there has not been wealth development, you know, in the Black community, the Brown community. And one of those things is retirement, for example. We don't think about the need for folks to retire. The work family childcare providers and early educators do is physically demanding. It is demanding in all kinds of ways, but it is also physically demanding. So what's something we can do with this money that's there and that could be done? How do we create and use it as well to give some of that relief, and at the same time bring more value to the work, to really start bringing in so that folks actually start coming into the field. So we're looking at this as the lens, because of what we said, how do we make these good jobs as they should be? They should be paid more than Justin Bieber. I'm sorry I'm using that name, but it just comes to mind, right? Like, Justin Bieber is doing way better than any of these providers, and I'm not trying to demean him, but the value that each provider brings to society is immense, as all educators. So I completely agree, and I think it's to be able to change the system within the system does not happen. So we have to shock it to know, and we're ready as labor to participate in shocking this system. And we can start with these bold demands that we have all been making in every setting, across policy setting, across the table. That's what providers do. And just to share what the table is, because I think everybody understands, we represent, I don't know if it's 40,000 family childcare providers after the pandemic, but close to. And there's 30 providers that sit at the table from throughout the state. They all have centers, and a lot of times they're working as they are at the table. It is their combined voice that is captured in this, in the endeavor that we do in collective bargaining. And whatever we capture there has an added level of strength, given that we have collective laws that protect. So for example, if we can set a floor in the collective bargaining on slots, we can set a floor. We can push for it. I'm not saying it's gonna happen, but it's a way to do it as we propose. We wanna set a floor and then an increase every year to get to 100% to the parents that need, right? So I think that's important to just point out that this is the collective voice, and surrounding the 30 providers, like the last bargaining session, there are hundreds of family childcare providers that have created a network to communicate about how to best do this. And as you know, as they're negotiating for their dignity and respect, rates, healthcare, you know, providers, they're also, the foremost thing in their mind is, how do I take better care of the children that are in my center? How do I make their, that's what they live for. So thank you for that contribution. Sorry, I'm long-winded.
Thank you. That's perfect. Hana, would you like to add to that?
Nothing that's not already mentioned. I just want to make sure as we think about equity for kids, we don't trade that for equity for childcare workers.
Thank you. And you all, this is a really good discussion, and it's a perfect segue to our next question. How do we make sure we advance racial equity for our children, and do so in making sure we advance racial equity for our workforce? So what does that look like within our system? Hana, I'll pose this question to you first. With the great need, urgency, and opportunity, what is important to bring to the forefront in advancing what we just discussed, racial equity, economic justice for our youngest children, their families, and the ECU workforce?
When I think about this question, I think about two things. So first is addressing the racial wage gap. And second is that we need data disaggregated by race and ethnicity, data that is actionable and reported in a way that families can interpret. So on the racial wage gap, Keisha mentioned the research of the UC Berkeley Center for Childcare Study and Employment. And you may be familiar with it. Black educators are paid less than their white counterparts. The younger the child, the lower the pay. And Black teachers are more likely to be assigned to teach infants and toddlers. right? And are we okay as a state knowing that we're paying childcare workers $13.43 an hour in 2019 as a median wage when kindergarten teachers make $41 an hour? So we can't expect our young learners to thrive if we continue to undermine the dignity of our early educators by paying them near poverty wages. And then the second point is disaggregated data. There's an investment in the May Revise on this, which is really exciting. And I also know CCRC's childcare data tool is very accessible. So what can we learn from that data tool to as we develop the statewide data tool? I know Advancement Project, I think, with the Santa Clara County Office of Education is co-sponsoring AB 568, which will create an early learning and care dashboard and make data publicly available. Currently, the data is there at the state level, but it's not disaggregated. And we know that while Black children are most likely to attend a state-funded childcare or preschool program, a higher percentage of them are enrolled in unlicensed programs than other children. And in some counties, there are no high-quality childcare centers in the lowest income neighborhoods. So I think having that data would be really critical to making sure that whatever investment we make is actually going to work and serve the families that need it most.
Thank you. Keisha, Max?
I don't think I have anything to add that's new. Except that it really is important. You know, I appreciate this. I think it's just reiterating what we all just said before.
Yeah.
is how to advance on this.
I mean, the best thing that could happen for young children is to be taught by people who are anti-racist, and that's not the case now. That's not the case universally. I mean, I'm not calling everybody racist. And as you say, the data bears that out, in how especially Black children are treated, how behaviors, developmentally normal and accepted behaviors are among white children are criminalized among even our youngest Black children and other children who aren't white. I would caution us. I know, people may know quality is a trigger word for me. And so I would caution us because that basis of quality is really based on what white folks have said quality is, because white women, especially at the, for, let's say from the 70s to 80s, are the most well-respected in early childhood education, their voices. And so we base quality based on white values and culture. And so though we may think that something is not high quality, it may be extremely high quality to the parents and families that are utilizing it. So I just caution us when we try to define which program is quality, which is not.
Go ahead, Max.
I just want to add one thing I think that's important to point out too is, and it's again going back to access, the childcare deserts, because where they're located, and I think it's something also that I think we need to start, a big impact to do that, and to start also seeing and ensuring that there is. The childcare providers are professionals. I wanted to put it here because I talk to them every week. I talk to a lot of them every week, and they are. And I think to the point that Keisha just made, this is kind of what sparked that the definition of quality and what they do, the lens that is viewed is not viewed as quality by society, but it's very important to really lift the point that Keisha made right now. Given that their programs are so, they are in the community, and they not only bring early education, they also kind of bring community to the community. I know that's redundant, but that's what I was trying to say. And so it's just important to acknowledge that and lift that point out. Thank you.
Max and Keisha, Hannah, those are really good points. And I do have to say, we focus on too much on quality. I have a 2.5-year-old. Actually, all of my kids, for the first 3 years, they were in grandma's care. And I feel like there's no quality more than granddad's love and care, right? So what they're dealing with and what they're learning is just, I don't think we can have it in any other space. So I appreciate that. What is quality? We sometimes have to question that, and it's different for everyone. And then Hana, you alluded to the bill, which we are so proud to co-sponsor, and you all are absolutely right. If we don't know the issues that we need to address, we're never going to be able to make policies, right? So it is so crucial for us to have that data, public data, so we and policymakers know how to address them and what to address, right? And the same bill actually also, to Keisha's point, deals with funding, so our providers have the tools and the training for anti-bias training. So we are actually putting in money for that piece as well, which is super crucial for our youngest learners. So we have the cultural competencies and to deal with our Black and Brown children. So it's really crucial that we have those two pieces together. This is a perfect, this goes into our next question around the opportunities around the mayor revise and the legislative proposals. So Keisha, I will start off this question with you. What are your reflections on the mayor revise and proposals from the state legislature? What are the strong proposal ideas we really need to lean into? And where do we have opportunities to go bolder and double down for our youngest children?
Well, the things that were, well, okay, what's good about the revise? There's a lot of money in it. It's a lot of federal dollars, and it's a lot of one-time money, one-time investments. What we don't see is much investment from the state into our early care and education system or ongoing funding. There is absolutely nothing to do with provider pay, and that's pretty horrific, especially after the year we've had. There are one-time stipends available for providers, and that, if and when it passes, will be extremely valuable to everyone who receives that and important. But it will be good for that month, and not their long-term viability and ability to sustain their own families. The governor proposes to suspend family fees. Family fees are what make our subsidized childcare system even unattainable for so many families who are able to utilize it, who are lucky enough to get a voucher or get a space. And both the families and the providers bear the brunt of when a family can't afford to pay for it. And so we encourage the state to utilize these one-time federal dollars to eliminate family fees for all families, whether they're in care right now or still sheltered in place for the next 4 years. And there's no reason we can't do that. And then we can take that time to make a more equitable family fee structure so that families aren't devastated. As was mentioned earlier, school-age children suddenly needed care all day. Those families' fees went through the roof. And they have to make choices between paying for childcare or paying their utility bill or their rent. And that's just, it does not have to be that way. We're choosing to make it that way. And yeah, 100,000 slots, that's nothing. Like, we got the money. We're choosing to, 100,000 is a lot of slots, but we could do 2. We could do 3. I'll settle for 2 this year.
Thank you, Hana.
So I also wear a K-12 hat. So my take may be a little rosier than that of Keisha's. So there's universal TK with a very ambitious timeline. And I'm curious, like, if the 4-year implementation time doesn't work out, is there a way that we can implement it with equity in mind? So for example, targeting districts that serve higher percentages of low-income students and English learners to start. And thinking about workforce issues, like how do we get enough teachers to teach 4-year-olds in a way that doesn't harm the preschool and early care and education system? All the questions that we're still thinking through. We're excited about the investment in community schools, high dosage tutoring, expanded learning, which includes after school and summer learning for students from low-income families.
Max?
Yes, so I think the budget, there's some things that, because we are at the table, some of the processes, for example, on rates, the governor, the way the law is written, has to bargain over rates directly with family childcare providers. Now, that doesn't take away the ability to the governor to have told us all, hey, I'm ready to invest $1 billion in improving, there's nothing stopping anybody from saying that. But I just wanted to put that. So what we see in the May revise again is this, I think to Keisha's point, there's not enough investment from the state. And there's some things missing that we are now still pushing at the table, including rates, including more increases in slot. On the elimination of fees, for example, we managed to advocate that, we managed, all of us, I think, to ensure that during the pandemic, they actually suspended them, but they have to do it in a way that doesn't just make the providers not perceive it. The family childcare provider reimbursement rate has to change, or there has to be, like what happened right now, that they're made whole. So as we're advocating for that, but it is imperative and important to it, because it's not just about expanding. We have to expand slots to meet the need, but we also then have to start the next level of parents that cannot afford flat out private, So what are they going to do? So we have to start thinking beyond just the slot system, which again, requires us imagining what could be done differently, instead of using a system that is basically inequitable and unequal, and there's not enough support. So we think that that's something that that we can keep pushing on, so that there's more. I think the legislature has proposed more than what the governor, and we need to push for that. At least get to 10%. They can do more, but 10%. Then another thing on the TK, that although Local 99 does represent 35,000 K-12 workers as well, but we also understand that there has to be a balance. We know, because our members are also classified employees, and also are Black and brown women doing work for very, very low pay. They also are parents that need family childcare providers to support them. So we cannot have a universal early parent system that only talks about TK and completely excludes what is going to be done to support an enhanced family childcare provider conditions, and actually support them in expanding their businesses and ensuring that those families, which we think that is a majority of families, will continue to need the flexible care and education that family childcare provide. So we think that the proposal is AB 22 is incomplete, and we are pushing not against universal TK. That's not what we're doing. We are pushing for how do we ensure that there's an approach that is balanced, and that also supports providers who throughout the pandemic are the ones that kept the society afloat. So that is what we're about. So what we say is that the proposal the governor has made, and AB 22, is an incomplete proposal, and we're still waiting to hear from the governor. What is it going to do to ensure to stabilize the family childcare provider workforce, and actually make sure that it's actually valued? And we're talking about how do we start breaking those structural barriers. So that's what I think on this budget process, that we're still in the middle of it, and we shouldn't, and it's important to keep pushing hard through everything that we do, through advocacy, through labor, as we're doing, through everything that we're doing.
Yeah, thank you.
Yep. I know we have to end, but I think that to that point is that this is the third year of a governor who clearly, unlike governors in the past, likes little kids. And so even though we're like only 100,000, we would have never seen 100,000 slot proposal in most of our careers ever. And so I don't want to, what's the word? I don't want to poo-poo that, but it's like, but we don't have to, we can still keep pushing, like Max just said. So
yeah, I completely agree. I think we have seen investments like never before. early career education system is a priority for a governor. That's a big deal. So we should celebrate it. And also as advocates, I think we cannot not continue to advocate and push, right? So it's really an opportunity for us to do that. And just one last question. I would be remiss if I don't say this. We have an opportunity. We have the governor's senior advisor on EC, we have the assembly majority floor leader, majority leader on. So you all just give me one thing, from your perspective, what is your call to action? If we have the policymakers listening, decisions makers listening, what is your one call to action that you would like to say before we end our panel?
That we don't box ourselves into the way things have been done just because that's the way things have been done forever.
Thank you. Max and Hannah?
So I'm thinking a little about the intersection between ECE and K-12. And we've been doing research on how LCAPs are prioritized in preschool. So this is a quote from Superintendent Jeff Harris from Del Norte Unified. He said, create a vision for what early childhood education could be and what you want it to be, and then fund it. Be creative, and everyone in your ecosystem, so the county, the community, private providers need to be a partner in making that happen. Schools cannot be the sole purveyor of education, and neither can private providers. It takes the village.
I've just jumped call to action, and I don't know how to put this, but it is imperative that first I want to commend that, yes, what everybody said, the governor is actually trying to create a master plan and cares about education. The Assembly and the Senate have shown, but it's not enough. It's just not enough. And I urge them to listen to the voices of the workers that do this work. They are assembled right now in California under CCPU, as they are also listening to all voices of all our advocates. I'm not excluding. Listen to them, because that is the key on how you actually start getting stabilizing, getting out of this and start creating a real system, because we have to be bold in transforming the system and forget what it was. That's the past. We need to start rebuilding, and it's important to rebuild, to start rebuilding strong. So that's the call to action. Listen to workers and continue to listen to workers. I don't want to say they haven't.
Well, on that positive note, thank you so much for participating. Thank you to Hana, Keisha, and Max for this wonderful conversation. Again, you're absolutely right. We are trying to figure out how to make, we want to be solutions oriented when it comes to the budget, and that's how we want to show up. So again, it is an opportunity for us to be bold, an opportunity for us to come together and reimagine our systems with an eye on addressing equity and holistic needs for our children and families.